Hey, this is Jennifer Peña. I'm an internal medicine doctor, and I'm here to tell you all about sexual health. Welcome to Doom Scroll.
Hey Jen,
Hey, Tessa, how are you?
I'm doing well. How are you?
I'm enjoying June. It's hot, and I'm going to every Pride Month celebration I can find here in town.
So I think it's awesome that you are doing stuff outside of the clinic with the trans community. How about in clinic? Are you getting a lot of patients coming in asking about like emergency contraception or other forms of contraception?
There's a lot of misunderstanding about contraception and emergency contraception in our trans community. And one of the topics that comes up pretty often is, do trans men need emergency contraception? Here's the deal: trans men or gender non binary, female assigned at birth, if they still have female organs of reproduction, so uterus and ovaries, they can still get pregnant, right? So, bottom line is, yes, we still offer emergency contraception as an option.
Do you ever counsel patients on how or when to talk to their partner about their anatomy and pregnancy risk and emergency contraception use? Does anyone ever ask when's the right time to bring it up?
Yeah, all the time. Some examples that come up are, do we have to speak to our partners about emergency contraception? Let's take, for example, trans women who have not had gender reassignment, so they still have testicles that produce semen. They can still get their partners pregnant. But again, this requires us understanding where they are, in terms of their anatomy, who their partners are, the type of sexual intercourse that they're engaging in, right? Because that also plays a role in it. And then making sure that at the end of the day, we're doing the right thing for the person and giving them the appropriate advice.
What are the implications of testosterone on risk for pregnancy? So, if a trans man is taking testosterone, can they still get pregnant, or what should I be counseling my patients on?
Although not all of our patients, our trans men patients, are on testosterone in their journey when they come to see us, a lot are. And so, what's important to remember is that testosterone may stop your periods, may stop menstruation if you have, female organs, and still have a period. But it is not a form of contraception, right? Testosterone very commonly will cause what we say is amenorrhea. So it might stop your periods altogether. But again, that doesn't mean that you can't still ovulate and get pregnant.
Obviously, there are a few different forms of emergency contraception. What forms do you recommend a trans man use?
So the good thing is that emergency contraception will not interfere with testosterone. And all methods of emergency contraception can be used. So IUD, any of the pills, whether they're on testosterone, gender affirming hormone therapy or not.
Thanks, Jen. This was super helpful. I love talking to you about all things medical, but especially just in the trans community, there's a lot of misunderstanding, or we don't talk about a lot of these things clearly enough. And so I appreciate us having this conversation. I think you're the best.
Me too, Tessa. And I'm really happy that we are, because, especially in our trans community, it's really important to find a level of comfort in talking about sexual health. So we really have to be transparent, and we have to be able to talk about it in a way that is non-judgmental, that makes, both the patient and the provider feel comfortable. And so the more we talk about it, I think the better it will be.
But let's talk soon.
Sounds good. I'll see you soon.
Okay, bye.
Bye.